Hi, Keri Stevens here. I'm going to share with you some research that my team and I have just completed having to do with health information during disasters. This project was funded by the National Science Foundation, and what we did is we are looking at how people issued calls for help when they needed to be rescued. In this particular study, one of the things we found is that people weren't getting the types of information they needed from official sources like Health and Human Services and the organizations that are out there sharing the health information. By the way, they were posting information through television, but a lot of these people lost power. And so they found themselves turning to social media to be able to get health information. So I'm going to share with you the key findings in this study, and I'm going to frame this around the notion that these private communities, these private Facebook groups that people are a part of, people feel a part of the group. We call that identification in our organizational communication literature. They feel identified with these people, and so whereas if you're just going out to a general public, there's less responsibility to be honest and objective and get really good information. We found that they were really caring and they were really accurate to the point where they could be, because they're not experts, when they shared this health information. So let me tell you the findings. We found there were two main categories of information being posted. The first main category was about existing medical conditions. Now, it does make sense that someone who has a chronic disease is going to have trouble evacuating in an emergency. But there's also some very interesting things going on here, like people who have had recent surgeries. They might be perfectly healthy young adults, but they can't get in to what our second main concern that we found, which was water-created concerns. So they can't get in dirty water if they have an open wound or they're trying to heal. So those were the two kind of key categories. And then the next thing that we did is we looked at how are they sharing this health information with these communities. And we found that there were 6 key themes. So the first key theme is, not surprisingly, they narrate their personal experiences. And sometimes these go into great details where people are kind of laying out what they've been through. The second theme we found is that people are actually including the words public service announcement, and they put up information and they couch it as a public service announcement. Now, we have some ideas from our research why this is the case, and it's really kind of linked to some of the other findings. People also tended to downplay their contribution, or they would bring in a credible source to support them. Let me give you an example. So someone might say, I have a friend who's a nurse, and she's going to come on to the Facebook feed very soon, and she's going to share what you do if you've been in the dirty water. How do you go seek medical care? So you're going to see that a lot of those themes start to coalesce around the ideas of how can I make sure I'm presenting information that's as credible as possible as a public service announcement and bring in these credible sources to give as accurate of information as possible. The next key finding is that people would include external links and links to sources, another indication that they want to be credible to their community. And then our final key theme that we found was they used humor. And you know, I think that in any kind of a disaster, we've certainly seen this in other research literature, but sometimes you just need to put something up there that's funny and try to give people a break to cope with the stress of what they're going through. So this finding will be presented at ISHCRAM, and it'll be published in those proceedings. I would encourage you to take a look at our paper. This is certainly a work in progress. We're doing a lot more work with this data. We think that we have a lot that we can contribute, especially in how people are using social media, in this case, to actually seek and share health information. Thank you so much.